I want parents to understand there are misconceptions afoot about the stimulants. They are not addictive as prescribed unless you inject or inhale them. They do not produce aggression, and they didn't cause Columbine. They are, in fact, able to reduce aggressive and antisocial behavior. They do not cause seizures. You'd have to swallow the whole bottle. So even children with seizure disorders can take these drugs safely. They do not cause tics or Tourette's unless you already are prone to tics or Tourette's, and then they may bring them out and make them worse. Even then, only in about 30% of the cases. The remaining cases do not experience a worsening of their tics, and so children with ADHD and tics can take these drugs safely as long as they're not one of the 30% that makes it worse. And by the way, the worsening is temporary. Stop the drug, the tics will go back to their baseline within a week. Are we overdosing ADHD children in North America? Absolutely not. If you look at the prevalence of the disorder, it's 7.5%. If you look at how many children are taking medication, it's between 4 and 5%, which means you are missing a third of all children. And by the way, 90% of all adults with ADHD are not treated. So, are we using more medication than ever before? Yes. Is it scandalous? No. What's our problem? We still have people who don't have access to care and who aren't being treated for their disorder. And that's the real problem, as our Surgeon General pointed out, not over-treatment in the United States or up here. Is there a risk of later substance abuse from the stimulants? Your own CBC ran a program on Marketplace. Marketplace? Is that what it's called? Right? The one with that little blonde hottie that used to date your member of parliament? Right? I just want to make sure I got the right program, that's all. Everybody knows when I say that. Oh, her! Yeah, we know. Okay. I have a bone to pick with that because they were, in fact, deceitful in their creation of that program, especially with our medical school. But nevertheless, they ran a program claiming that stimulants can predispose children to cocaine abuse, nicotine, and other drugs of abuse later in life if your children took them. This was based upon a single study done by Nadine Lambert in San Francisco. Nadine's study has many, many flaws in it, not the least of which is she never controlled for conduct disorder, which is the biggest predictor of drug abuse among ADHD children. And when you control for that, there is no link between being treated with a stimulant and abusing any drug. How do I know that? Because 17, you can correct this slide, 17 studies, including my own, have now shown no relationship between length of time you take a stimulant throughout childhood and risk of any abuse in adulthood. So there's your box score, 17 to 1. What did the CBC focus on? The 1. Why? Because we all know now that televised journalism is a form of entertainment, not a form of information. That they go after the scandal, the underbelly, the sensational side, and they ignore anything that does not fit that preconceived idea. And that's exactly what the CBC did, which was, I think, a travesty of journalism. Do they improve academic achievement? No, not at the start. But we now have several studies, including one published a week ago, that show that if you stay on your medication at least 2 years or more, we do start to see an uptick in academic achievement skills. But prior to that time, what the drugs are doing is improving your productivity, the amount of work you do. But there's no knowledge in a pill. So why would you know your multiplication tables when you take your Concerta when you didn't know them the day before, right? But what the drugs do is to make you available for learning. And if you stay available for learning over a long enough period of time, you do learn more, but not in the short run. And then I mentioned Strattera. I'm not going to go over that because I've already mentioned it, but it is the non-stimulant on the market right now. And as I said, we will have another one later on. It's a very good drug, especially for kids who have anxiety or tics or OCD or insomnia or other sleep problems.